Hello everyone, my name is Matthew Steans, founder of Stigma Statistics, a social venture enabling suicide prevention through data insights. It is an honour to present to you at the Digital Innovation and Mental Health Conference this year, although it is a bit weird to present to a recorded screen. Is it great that we still get the opportunity to share our experiences and learning? Today I'm going to talk about suicide prevention in the digital world, set out my vision for the future and discuss a roadmap to achieving this vision. To begin with, I'd like to rewind back to 2013 when I was going through a period of depression. One particular day when I was working in a high-rise building where I witnessed someone jump off a car parking building opposite to their death in what could only be assumed was a suicide. That was a trigger for me to get myself sorted. Coming out of my second psychologist session, I had a bunch of missed calls to find out a friend of mine had also died by suicide. Cutting a very long story short and fast forwarding to today, Stigma Statistics is enabling suicide prevention through data insights. We have a web-based platform for the collation, sharing, analysis and reporting of suicide data. And we're now in several local authorities in the UK. Looking at the global picture, there's over 800,000 suicides every year. And that puts it in epidemic, proportions. And in the UK, there was 6,507 deaths in 2018, and every death, it's estimated 135 people are impacted. And that ripple effect so leads out to, nearly 900,000. Of that, we know that 10% of suicides are by those who are bereaved by suicide. So that gives us a real identifier of at high risk people. And the cost, we look at it's a high cost, 1.67 million per death. 70% of that borne by close family and friends, 21% through loss of productivity, the economy, and 9% direct costs. And then we have an additional 400,000 if it's on the rail. Across the world, the World Health Organization mandates every country to have a suicide prevention strategy. At the moment, we have 40 countries with a strategy, and they're of varying degrees of implementation. And I think, I can pick out the UK and New Zealand as sort of leaders in that area. How does the process work when it comes to suicide surveillance and what we're doing with Stigma? And we're not the only provider in this market. So police attend sudden death. They fill out a handwritten form, sign it and send it to the coroner. And at the same time, they can get consent from the next of kin for bereavement support. And if the coroner agrees, that information can also be shared with local authorities, local public health support charities, NHS, etc. But it's all very spreadsheet and manual form based. Then looking at the basic process of real-time surveillance in a digital world, the first step, it's the same. The form's still done by the police officer attending the sudden death. You can then take those details and enter it in a platform where it's shared with the key services, and they get one source of truth. And then they have the real-time reporting and all those sort of things. But I think this is the basic model, and I think we can take it up a notch. If you always do what you've always done, you always get what you always got. And I think this really applies to suicide prevention in this day and age. In a COVID digital remote working world, we no longer are able to run on handwritten forms and spreadsheets. These ways of working had been obsolete before the pandemic came along. It just took a massive shock to move us. However, we still have a long way to go. We need to break down silos, link up antiquated and disjointed processes, bring all services and relevant parties to the same table. We also need to draw out on data insights and analysis, not historically considered in this context before. Once we have all of these, we can also provide timely support for the bereaved, looking back at that stat that is 10% of all suicides by those who are the bereaved. Now, my vision for suicide prevention and postvention support. A university LinkedIn aligned platforms to enable suicide prevention. This platform will pull data from various relevant sources. This will be in the form of police, coroner and regional service information, but also social media and other publicly available data that gives us a full picture of what's happening in the area. We can add in, call centre data, all those kind of things. The importance of being globally linked and aligned is that people travel. We have friends and family around the world. The ripples from one suicide bereavement are not restricted by county lines or country borders. We need to easily identify people for post-vention support further than just the next of kin. Now, this will free up suicide prevention staff to really work on providing that support and actioning the tasks required. Steps to realise this vision. Well, starting with our lovely topic of data sharing and GDPR. There are now a number of multi-party agency data sharing agreements in play. We're using one with Stigma in Cambridgeshire and Peterborough and other areas. We've got Thrive London and QES and have one here. We can build off these to have an accepted standard. To be honest, I do think we're already there. They just need to be extended to include things for attempted suicide and contact with a vulnerable person. The next step would be to agree a minimum data set for collation. Stigma uses 9 pieces of information as a base for demographics, but we need to go further than that. It is also dependent on whether the next of kin gives consent for support. Third, start or continue using a real-time suicide surveillance platform and get all services on board. This gives us one source of truth. And I don't mean using spreadsheet or the back of an envelope here. It's important that it is a web-based, easy-to-share system with all services on board. I can't emphasize that point enough. Then we look to start giving permission and access to national and international organisations in a hub and spoke model. The data would be anonymised at national and international level, but still able to drive tangible actions. Actionable prevention tasks. 5, once we have a web-based platform with all services using it, we have a base upon which to pull in other various data sources to give a full, in-depth picture of what is happening. Examples here are Google Trends, as I said before, helpline, call volumes, social media sedimentary tools, other mental health, social, financial indicators, etc. We can also look to start collecting attempted suicide data, although that will be anonymised as a key point there under GDPR. We can also collect life-saving interventions or contact with a vulnerable person. British Transport Police collect that here in the UK on the rail, obviously, and I would like to see that extended to the remaining 95% of cases. Next, we can integrate with police and coroner systems to remove all manual input of data. This ensures data accuracy and integrity, but also, again, frees up that resource to get out and action the prevention, intervention and post-vention activities we've highlighted the need for above. Now, there is a lot more detail to these steps than today's time would allow, but this gives us a roadmap to enabling suicide prevention and in turn saving lives in a digital world. Now, I just wanted to quickly touch on the process in a bit more detail to kind of show how it works, but that the actions, once you get the data in the system, the platform can trigger alerts and send information for bereavement support. You can do that historical analysis, start to pull in other data of what else is in the area, what else is going on, and again, those social media trends. We can do that escalation plans and care pathways instantly and not have to wait for the 3 and 3 months classification that has for an escalation plan in the UK. You could do it real time. And of course, we've got our reporting. And the real key one there is what lessons have we learnt and how can we go on to prevent it in the future? this all leads to the basic there that all suicides are preventable. If we can just save one life, that would be amazing. However, with this model, I think we can save a lot more. Thank you very much. Please do get in touch on Matthew at stigmastats.co.uk or visit our website for more information. Thanks very much.